Your health is one of the most valuable assets you possess, and being attentive to changes in your body can be crucial for early detection of potential problems. The breasts, in particular, are an area where awareness can make a significant difference. While most breast changes are benign and not cause for alarm, there are certain signs that should never be ignored. Understanding these symptoms can empower you to seek medical advice promptly and take charge of your health. Here are 8 important signs on your breasts that you should never overlook. The first sign to pay attention to is the presence of a new lump or mass in your breast or underarm area. Many breast lumps are benign, such as cysts or fibroadenomas, but any new lump should be evaluated by a medical professional. Cancerous lumps are often painless, hard, and irregular in shape, though that they can also be tender, soft, or rounded. It's important to note that not all lumps are cancerous, but a new, persistent lump that feels different from the rest of your breast tissue warrants a visit to your healthcare provider. Early detection is key, and even if the lump turns out to be harmless, having it checked is always the safest course of action. The second sign is changes in the size or shape of your breast. Breasts naturally come in all shapes and sizes, and minor fluctuations are normal, especially around your menstrual cycle. However, if you notice one breast becoming significantly larger, smaller, or taking on an unusual shape compared to the other, it's time to pay closer attention. These changes could indicate an underlying issue, such as an infection, cyst, or, in rare cases, breast cancer. Sudden swelling or shrinkage that doesn't resolve should not be dismissed, especially if it's limited to one side. The third sign is skin changes on your breast. The skin covering your breasts should be smooth and consistent in appearance. Be watchful for redness, dimpling, puckering, or thickening of the skin, which can sometimes resemble the texture of an orange peel, a condition known as peau d'orange. Such changes may point to an inflammatory process, or in some cases, an aggressive form of breast cancer. Persistent redness or irritation, especially when not explained by a recent injury or rash, should be assessed by a healthcare professional. Fourth, be alert to nipple changes, such as retraction or inversion. Some people naturally have inverted nipples, but if your nipple suddenly starts to turn inward, flattens, or changes direction, this could be a sign of an underlying issue. Nipple retraction can be caused by benign conditions like infections or inflammation, but in some cases, it may be an early sign of breast cancer. Any sudden, unexplained change in the appearance of your nipple deserves medical attention. The fifth sign is nipple discharge, especially if it is spontaneous, persistent, and coming from only one nipple. Discharge can be many colors: clear, yellow, green, or even bloody. While most nipple discharge is not cancerous and can be related to benign conditions, such as infections, hormonal changes, or benign growths like papillomas, discharge that is bloody or occurs without squeezing the nipple should be evaluated by a doctor. This is particularly important if you are not breastfeeding or pregnant when the discharge occurs. The sixth sign to watch for is persistent pain in your breast or nipple. Breast pain, also known as mastalgia, is common and usually related to hormonal fluctuations, but pain that is localized, persistent, and not related to your menstrual cycle should not be ignored. While breast cancer is rarely painful in its early stages, some types can cause discomfort, especially as they grow or spread to surrounding tissues. If you experience ongoing pain in one area of your breast, especially if it persists for more than a few weeks, seek medical advice to determine the cause. The seventh sign is swelling, warmth, or redness of the breast. These symptoms can be caused by infections such as mastitis, which are more common in breastfeeding women. However, if you are not breastfeeding and these signs persist, it's important to rule out more serious conditions. Inflammatory breast cancer, while rare, can cause the breast to become swollen, red, and tender. This form of cancer tends to progress rapidly, so prompt evaluation is critical if you notice these symptoms. The eighth and final sign is the appearance of a sore or rash that does not heal, particularly on the nipple or areola. While skin conditions like eczema can affect the breasts, a persistent, crusty, scaly, or itchy sore on the nipple could be a sign of Paget's disease of the breast, a rare type of cancer. Any sore or rash that resists treatment or keeps returning deserves a closer look from a healthcare provider, especially if it is accompanied by other changes, such as discharge or inversion. Recognizing these 8 signs does not mean you should panic if you notice one of them. Many benign conditions can cause changes in the breasts. However, staying vigilant and seeking timely medical advice is essential. Early detection gives you the best chance of successful treatment, especially when it comes to breast cancer. It's also important to perform regular self-examinations to familiarize yourself with the normal look and feel of your breasts. The best time to do a self-exam is a few days after your menstrual period ends, when breasts are least likely to be swollen or tender. If you no longer have periods, choose a consistent day each month. Using the pads of your fingers, gently move them in a circular motion over the entire breast and armpit area, checking for lumps, thickening, or any unusual changes. Look at your breasts in the mirror, with your arms at your sides, raised above your head, and pressed against your hips, noting any visible changes in contour, skin texture, or nipple appearance. In addition to self-exams, follow the screening recommendations provided by your healthcare provider. Guidelines vary based on age, family history, and personal risk factors, but most organizations recommend mammograms starting in your 40s or earlier if you have a higher risk. If you have a family history of breast or ovarian cancer, you may benefit from genetic counseling and earlier or more frequent screenings. Lifestyle choices can also play a role in breast health. Maintaining a healthy weight, staying physically active, limiting alcohol consumption, and avoiding smoking are all measures that can lower your risk of breast cancer. A diet rich in fruits, vegetables, whole grains, and lean proteins supports overall health and may provide some protective benefits for breast tissue. It's also important to remember that men can develop breast cancer too, though it is much less common. Men should also be alert to changes such as lumps, nipple discharge, or skin changes, and seek medical evaluation if these symptoms occur. In summary, your breasts may undergo many changes throughout your life, most of which are completely normal and harmless. However, there are certain signs, such as a new lump, changes in size or shape, skin changes, nipple inversion, abnormal discharge, persistent pain, unexplained redness or swelling, and sores or rashes that do not heal, that should never be ignored. Trust your instincts and listen to your body. If you notice anything unusual, don't hesitate to reach out to your healthcare provider. Taking these steps can make a significant difference in your health and well-being, offering peace of mind and, if necessary, enabling early intervention for the best possible outcome. Remember, when it comes to your health, it's always better to be safe and proactive.